I chose Sustainable Development Goal number 3, which is good health and well-being. Sustainable Development Goal number 3 is explained by the United Nations to ensure healthy lives and promote well-being for all at all ages. A few targets of this goal include by 2030, reduce the global maternal mortality ratio to less than 70 per 100,000 live births. By 2030, end preventable deaths of newborns and children under 5 years of age, with all countries aiming to reduce neonatal mortality to at least as low as 12 per 1,000 live births, and under 5 mortality to at least as low as 25 per 1,000 live births. By 2030, end the epidemics of AIDS, tuberculosis, malaria, and neglected tropical diseases, and combat hepatitis, waterborne diseases, and other communicable diseases. The country I chose is Chad, and this information comes from our World in Data. The life expectancy is 52 and a half years. The maternal mortality ratio is 1,063 deaths per 100,000 live births. The child mortality rate is 10.3%. The share of mothers visited by a health professional during pregnancy is 54.7%. And then the share of the population using safely managed sanitation facilities is 10.9%. And then childhood deaths from infectious diseases in 2021. So for diarrheal diseases, that number was 20,375. For lower respiratory infections, that number was 13,026. Malaria was 5,531. Measles was 3,096. Meningitis was 2,382. And then HIV and AIDS was 70. In comparison to the United States, the life expectancy is 77.2 years. The maternal mortality ratio is 21 deaths per 100,000 live births. The child mortality rate is 0.6%. The share of mothers visited by a health professional during pregnancy is 98%. And then the share of the population using safely managed sanitation facilities is 97%. And then childhood deaths from infectious diseases in 2021. And so the most deaths that they had was lower respiratory infections and then diarrheal diseases second. So the first one was 318 and then 98. And then following that is meningitis with 94, HIV and AIDS with 29, measles with 1, and malaria 0. And then these are my GIT solutions. So for the first one, that is share of mothers visited by a health professional during pregnancy is 54.7%. I think that 5G networks could be installed to support advanced healthcare in low-income areas. These networks would allow for remote healthcare in the form of patient monitoring, diagnostic procedures, and robot-assisted surgeries if necessary. These services could be provided through nonprofit organizations with the help of volunteers. And then the second one is share of the population using safely managed sanitation facilities is 10.9%. And then I think that the Internet of Things could use big data to analyze problem areas regarding sanitation facilities. After analysis, smart technology like air monitoring and water purification systems could be put in place to ensure consistent safety regarding such necessities. These services could be provided through nonprofits organized by the government. And then the last one is childhood deaths from infectious diseases in 2021 is 44,480. And then I think that artificial intelligence could be used to detect various diseases and their causes. Machine learning could then develop strategic plans derived from big data to solve certain issues. A multitude of solutions could be applied as AI personalizes each solution to certain issues that have arose. And then these are my references if you have any further questions.